Today we're talking about laryngeal paralysis, or LAR-PAR, in dogs. The larynx is the gateway to the trachea. During inspiration, the arytenoid cartilages should abduct, or open, so air can move into the airway. The main muscle that opens the larynx is the cricoarytenoideus dorsalis, and it is controlled by the recurrent laryngeal nerve, which comes from the vagus nerve. In laryngeal paralysis, that nerve muscle system fails. The arytenoids do not open normally, so the airway stays narrow during inspiration. The dog has to pull air through a small opening, causing inspiratory stridor, increased respiratory effort, heat intolerance, exercise intolerance, voice change, gagging, coughing, and sometimes collapse. Severe cases can become emergencies because stress and heat worsen breathing, which leads to more panic, airway swelling, and overheating. The classic patient is an older large breed dog, especially a Labrador Retriever. Many acquired cases are part of geriatric-onset laryngeal paralysis polyneuropathy, or GOLPP. That is why some dogs also have rear limb weakness, decreased reflexes, or megaesophagus. Other causes include congenital disease, trauma, neck or chest masses, previous surgery, inflammation, or idiopathic nerve degeneration. Diagnostics start with history and physical exam. Listen for harsh inspiratory noise, voice change, increased effort, and heat or exercise intolerance. If the dog is distressed, check temperature, oxygenation, and overall respiratory stability. Thoracic radiographs help look for aspiration pneumonia, megaesophagus, or other chest disease. Blood work screens for systemic disease, and a neurologic exam helps assess for polyneuropathy. The definitive diagnosis is a laryngeal exam under light anesthesia or sedation. The key finding is absent or weak arytenoid abduction during inspiration, or paradoxical movement where the arytenoids move inward when they should open. Emergency treatment includes oxygen, cooling if hyperthermic, minimizing stress, sedation when needed, for access, and fluids if appropriate. If the dog cannot move air, intubation or temporary tracheostomy may be needed. Long-term treatment depends on severity. Mild cases may be managed with weight loss, avoiding heat, using a harness instead of a neck collar, limiting exercise, and reducing stress. The main surgical treatment is unilateral arytenoid lateralization, or tie-back surgery, where one arytenoid is held open to improve airflow. This helps breathing, but it does not restore normal laryngeal function. The major complication to remember is aspiration pneumonia. Big takeaway: LAR-PAR is failure of the larynx to open during inspiration. Diagnose it with clinical signs plus light anesthesia laryngoscopy, stabilize respiratory emergencies fast, and treat significant cases with tie-back surgery while monitoring for aspiration pneumonia.